but thank you all for joining tonight for what I think could be an adventurous, pun intended, discussion. And because there's a lot of tips that I've learned, as I've mentioned, from individuals who are impacted by both these conditions. So thank you once again to all the panelists in the Institute. And just to let everyone know, this is my disclosure. And tonight we thought we would actually chat about some of the challenges that are associated with traveling when you have been diagnosed with celiac disease. And I say this and/or IBD because I certainly do know that some individuals are affected by both conditions, as well as to summarize some of the tips that we have should you want to travel. And travel can include anything. That can include car, that can include plane, that can include domestic, that can include international. Don't forget boats. And I don't know if you can afford it, maybe take a space shuttle out of our atmosphere, but all kinds of travels, tips if you are impacted by celiac disease and IBD. So I don't think we need to go into much detail about what these conditions are. We certainly know that they affect the gastrointestinal system. Both celiac disease and IBD are autoimmune, inflammatory conditions, which actually is quite important to think about when we start talking about some of the recommendations that exist for traveling. In celiac disease, it is an abnormal response of the immune system to a protein found in specific grains called gluten. In inflammatory bowel disease, it's an abnormal response of the immune system to the gut microbiome. Both conditions involve genetic susceptibility, which we know. In individuals with celiac disease, at this time, the only treatment for the condition is medical nutrition therapy with a strict gluten-free diet. There are no medications that can help manage this disease at this time, although there is research looking into that. In inflammatory bowel disease, under that umbrella, there's Crohn's disease, there's ulcerative colitis, and then there's a little bit more of a newer acronym called IBDU, at least, that we utilize in pediatrics, and which as we refer to it in medicine, the disease phenotype, or which disease, because they're two different diseases, may not be quite so clear. Ulcerative colitis, we say it involves the colon. It is inflammation of the mucosa. It's usually, as we say, quite diffuse, meaning it affects a big portion of the colon, unlike Crohn's disease, which is often patchy. In pediatrics, we like to say it can affect an individual gum to bum, and it penetrates layers of the gastrointestinal tract, which is then associated with different comorbidities. So that can be things like strictures or fistulas or abscesses. And as that relates to that condition, depending on what you've been diagnosed with, and maybe some other variables that your IBD doctors are very familiar with, there are different medications that may be prescribed and or different forms of nutritional therapy to treat inflammatory bowel disease. Celiac disease, it often can be a condition that has a myriad of symptoms. So it can also affect individuals gum to bum, but not just affect the gastrointestinal tract. We know individuals with celiac disease can also have symptoms that we refer to as being extra-intestinal. So it can affect the skin or the dermis. It can affect concentration. It can affect levels of energy. It can affect your well-being in general, as does IBD. IBD also is referred to as a condition of remittance and relapse, meaning you can be in periods of remission and then experience periods of flare where the disease becomes active again. At this time, neither celiac disease nor IBD have a cure. However, we certainly do know that both conditions can affect quality of life, and quality of life can include things like travel. So we hope that today there might be some positive stories to share, as well as information to encourage everyone to travel despite being diagnosed with both of these conditions. The other thing that we do know about both these conditions, excuse me, is that food eating intake can be affected. And of course, being a registered dietitian, food is pivotal to my role on a multidisciplinary team. And we know that food is more than just nutrition. It's more than just giving you those nutrients that allow you to have your physiological functions happen. They're very important for overall health and well-being, absolutely. But they also, they establish who we are. It's one of eating and enjoying eating and eating while away are one of the most important social activities that humans do. It's a way that we communicate. It's a way that we engage. It's a way that we identify with ourselves as well as others. There's a lot of emotion involved in eating. I know if I'm having a really bad day, there might be a pint of ice cream that gets consumed. No differently than if we're not feeling well, we might not have an appetite or a desire to eat, and that also impacts our quality of life. Both celiac disease and IBD have a plethora of sort of factors that impact how well somebody has a desire to eat, as well as what they eat. And so this webinar in particular is focusing on how food in these conditions can be a positive experience when you're traveling to ensure that individuals feel healthy and stay healthy while they're away, while also enjoying their experience. So we do know that individuals with celiac disease report certain challenges, burdens that are associated with having to maintain that strict gluten-free diet. And that's not just when you're traveling, that's also in your everyday life. Following a strict gluten-free diet can be extraordinarily emotional for individuals. There can be periods of positive emotional experiences as well as those that are considered potentially negative, things like anxiety, frustration, and anger with having to be so strict around your treatment. Not just in the home, not just with preparing your food, but also with being able to eat out, to socialize, to go to events where maybe options around safe gluten-free items are not available. Or there's concerns that even if there are safe gluten-free options, they might not be safe because they might be contaminated with gluten, and that we know isn't safe for individuals with celiac disease. There's often a sense of stigmatism that if you are reporting your gluten-free needs, that you're just being difficult, or you're being a snob, or, there's different layers of stereotypes that are associated with reporting to individuals, particularly in food service areas, what your gluten-free needs are. There's also relationships that get impacted both with family, with friends, with colleagues, with peers, and that may be associated with social withdrawal. And that has a ripple effect on everyday life, which can impact travel. Travel is costly, and we know that the gluten-free diet in and of itself is costly. So you add in extra factors when you're traveling with celiac disease, you have to be able to financially afford it. Accessing safe gluten-free foods, both while you are in your residential area or traveling, is an issue. Finding gluten-free foods that are safe is an issue. And all of these challenges that have been reported by individuals who need to be strictly gluten-free as the only way to manage their condition certainly reduces the amount of travel that one may think they're capable of doing and or maybe may feel comfortable or competent doing. And so we hope that sharing information tonight, we might be able to give tips to inspire individuals who are concerned about traveling that you actually can do it safely. And we know that this isn't just based on data that's, 10, 20 years old. The Canadian Celiac Association recently released the State of Celiac survey results. So thank you to everyone who is affected by celiac disease across Canada, participated in this survey. We know that there are barriers to being strictly gluten-free in everyday life, and one of them as mentioned previous, is traveling. There are a lot of individuals with celiac disease who don't necessarily find travel enjoyable, and or because of a sense of feeling like they won't be safe, choose not to travel to certain destinations. And so when we know we're talking about the gluten-free diet, we're talking about avoiding all sources of these proteins, these gluten proteins that are naturally found in wheat, barley, rye, triticale, and they need to be avoided from all sources of drink, food, medication, supplements, as well as any source of gluten cross contact. And it's that variable of gluten cross contact, at least that families that I've worked with tell me is a huge stressor when traveling for them. How do I trust that the person at the resort is going to properly prepare and handle the food before it comes to me? How do I know that the individuals on the plane picked the right meal for me to ensure that it's strictly gluten-free? You know, it's that concept of not knowing and how to be able to tackle that I think is a skill set that is worthwhile diving deeper into, but also maybe discussing during the Q&A. There's a really, really interesting study that I actually had never read prior to having this opportunity to put together this presentation. And individuals with celiac disease in this 2019 study actually said that they felt that they needed to feel very comfortable, competent, and confident with the strict gluten-free diet for at least 5 years before they felt like they could travel. And I thought that that was very insightful. It means that you first want to feel comfortable within your day-to-day life, comfortable within your home environment, comfortable with the people you trust before you feel like you could venture out there. And so we hope that by sharing more experiences, maybe there won't be such a time lag or such a time gap to individuals with celiac disease feeling like they can travel. The other challenges that have been mentioned around traveling or potentially certain destinations, some areas of the world align with Canada as it relates to what's considered safe for individuals with celiac disease. So we know that in order for a food product to receive a gluten-free label in Canada, it must measure less than 20 parts per million of gluten in that product per that serving. In other parts of the world, those cutoffs may not even exist. We also do know, particularly in Canada, there's been a lot of research looking at things like food processing plants, areas that deal with taking food from the farmland and bringing it into stores may actually impact whether or not there's sources of gluten cross contact. And this study about 20 years ago in India did show that individuals traveling to South Asia who need to be strictly gluten-free might be purchasing products that are otherwise considered naturally gluten-free but have been contaminated with gluten during the milling process. A study in Brazil also highlighted that sometimes even in establishments that are supposed to provide you with safe gluten-free products, that in those instances, some of those products may detect or have levels of greater than 20 parts per million gluten. And so to have an awareness that this exists all over the world, not just in certain pockets. I can say even in Canada alone, even in Australia with this recent release of the Aussie Bites that actually have gluten levels that detect higher than considered safe. Even in countries that are known to have very, very safe laws and regulations around safe gluten-free foods in Italy, where foods that were available at local grocery stores, those that were labeled gluten-free, there was about 10% of them that were not considered safe when they were tested. So it's to say these things can occur at home, even here in Canada, even in America, but in other places of the world. And it's to say that maybe when you do travel, you might get gluten. But that is not a reason to not necessarily travel. It's about how can you plan and prepare to ensure that should you get a gluten exposure and become unwell, you can help manage the symptoms while you are abroad. I also highlight that even amongst practitioners that are knowledgeable in food preparation, so chefs and other food prep uh, technicians and trainees, they might be familiar with the condition celiac disease, but still not know how to take the steps necessary to minimize gluten cross contact and ensure that the meal that's being served to you is also safe, not just that the ingredients are safe. And so I mention this because I certainly encourage my families to be vocal and to be proud and to not be shy and to say, hey, can you please make sure that when you're using a serving utensil, you haven't double dipped it somewhere? You know, if I'm going to go and get gelato in Italy, I want to make sure that the scoop hasn't touched, cones that otherwise contain gluten in them. And so it's to say that even though there is an awareness of celiac disease around the globe, individuals that are also preparing your meals might not know. So to connect with food management and food service staff and to vocalize your needs in such a way that can also help the rest of your trip. So when you do have celiac disease and you're preparing and you're planning, I just decided I was going to smush those words together, didn't I? So we're going to say we're going to be pre-planning for travel, having certain tools already prepared before you either take off or drive off or sail off are important. We certainly encourage having a medical letter that confirms the diagnoses that can be used when you are traveling to help communicate your needs. Contacting the establishments and or the different means of transportation prior to travel to know if they can adequately accommodate your gluten-free needs is always helpful. I will highlight for you a wonderful webinar that was hosted by the Canadian Celiac Association and Mark, where he gave his own personal experiences of traveling and provided some, cruise line experiences. I know Disney, of course, I work in pediatrics. I know Disney, and I promise I get no commission for Disney World or Disney cruises, but they are unbelievable at accommodating celiac disease as well as food allergy for individuals. So calling ahead of time and finding out what can be done is always great. And I certainly love a good buffet. But in this instance, both for individuals with celiac disease and IBD, we do say avoid buffets for different reasons, of course. In the instance of having celiac disease, you're not quite sure where those trays have gone, what utensils have touched what. It's just a really high risk area for gluten cross contact. Pack, see if you can somehow get a little extra carry-on. Should you be traveling by air, full of gluten-free products that you know are safe and that you can tolerate, that are non-perishable, that can go with you, things like gluten-free protein bars, gluten-free granola bars, gluten-free crackers, gluten-free trail mixes, things that can sustain you, give you healthy fats, good protein, some gluten-free carbohydrate to tie you over. I have to say, travel is stressful. You never know if you're going to take off on time, if you're going to connect on time. You may end up in areas of the world where they don't have gluten-free food that's easy to purchase from a vending machine or from a food establishment. So you always want to have these things handy and ready for yourself and your family members. I often tell individuals with celiac disease when you're traveling, because you might get gluten, should, for example, diarrhea be a symptom of a gluten exposure, you might want to take some anti-diarrheal medications with you that are going to work, something like Imodium, if it's nausea that affects you, you might want to take some anti-nausea medication. If there's pain and something like acetamin works for you and you're not sure if you can get it, just do a little care package of whatever over-the-counters or otherwise medications you have on your med list that will help you manage your symptoms. Take those with you, because while there might be alternatives or comparable products, you might not know how to speak with the pharmacist or read the label or know that what you're taking is actually going to work with you and your body. Definitely, definitely, definitely use the internet. There's a lot of wonderful information, which I'll also be sharing on these slides that you can look at before you travel. There's apps like FINI, gluten-free. There's blogs where individuals will tell you what works, what doesn't work. Mark talks a lot even about he travels for work, so he uses food delivery services, things like Uber Eats, and making sure that when you are communicating what it is that you'd like to eat, that you caps it and you bold it and you let the people know that are delivering you the food. I have celiac disease. I need to make sure it's strictly gluten-free. Ask before you eat, ask before you open, take all those steps just to make sure that what you will be consuming has the lowest amount of gluten possible for you. And of course, if you like to travel over the border, get some deals on some gluten-free products that aren't necessarily available locally. I do talk about border security, and just making sure that you keep your receipts should you travel from anywhere in the world with gluten-free products, so that if you need to show to security, you have that available. And certainly do not bring back perishable items. For anybody who doesn't know, Travel Canada does have a lot of information about what you can travel with. Try not to be like my extended family members who have tried to come back with cheeses and cured meats and all that good stuff that got thrown in the garbage. Okay, so Mark Johnson, he has been a volunteer with the Canadian Celiac Association for a very long time. He has also a wonderful webinar presentation that I encourage. It's like 20 minutes. I encourage everyone to watch. There are some really nice tips that are there as well. There's also this link here for individuals who are traveling to areas where they don't speak the native language or the native tongue. There are these diners cards that are completely free and printable, and essentially in whatever language of said country that you're traveling to, it actually explains that you have celiac disease and you need to be strictly gluten-free, which can then be shared as a means of being able to communicate. Now, these were really, really helpful, I would say about 20 years ago, and a lot of people used to use them a lot more than I find now. Google Translate on your phone might work just as well. So I thank goodness for smartphones, but just to let you know, if you like something in your wallet or with your passport, these do exist, and they come in a plethora of languages. The International Society for the Study of Celiac Disease, also a nonprofit organization, they have a wonderful link to various different celiac-specific organizations around the globe, where there's also contacts where you can reach out to individuals in other countries and ask and learn a bit more, maybe about the food processing, food labeling, food manufacturing, anything to help keep you safe while you're traveling along those lines. It's a very, very resourceful website, and we'll be sure to share these links with everyone too. Now, as it relates to IBD, there is a lot of overlap with traveling, and some of the tips are going to be identical. There's also some differences and some nuances. Now, what we do know of individuals on IBD is if they are on immunomodulators or if you're on a biologic therapy, there are reports to say that there's a higher risk of contracting some kind of infection when you're traveling. Okay, so you want to be mindful, because if you do contract an infection, that might actually impact your state of remittance, meaning some individuals who get unwell while they travel, when they get an infection, it may elicit an immune response that then kind of sort of sets off, whether you're in remission or not. So you want to be mindful that you want to avoid getting an infection. Okay. We also do know that individuals with IBD may experience flares while traveling, in particular, traveling by air to other other environments across the globe. And this definitely can impact not just when you arrive at a destination, but your experience when you're at a destination. So if you're feeling well when you start your journey, but then you experience a flare when you are away, what do you do? How do you handle it? Especially if your maintenance therapy has been working for you and you did bring it with you, or you just, for example, may have gotten an infusion just before you left to ensure you've got your top-ups, you've got your drug in you, and you're good to go. I will say There is also reports that individuals with IBD have an increased rate in flares when they come back as well. Now, whether or not that's related to a delayed response to an infection, whether or not it's related to the stressors of travel, it's not clear, but it's just to be mindful that you want to feel your strongest, feel your best, make sure that you're in clinical remission, check in with your medical team before you travel so that you can minimize these risks either before, during, or after. The other thing that I actually found quite interesting, I don't come across this in the pediatric world as much, but certainly there are reports in adult literature that say information given to individuals affected by IBD is a little bit limiting before they travel. And referrals as to whether or not you need to go to a travel clinic may or may not happen. So I bring this up only because I do think as advocates for our own health and our own therapeutic plans, we want to bring it up to our teams that, hey, I'm going away somewhere. And that might not be the first thing you're going to think about when you go visit your IBD team and your IBD doctor, but it's to say, hey, I'm planning on going to Croatia. I'm planning on going to Switzerland and Paris and Italy. Oh my goodness, these trips are going to be amazing. By the way, the gluten-free food in all these countries is unbelievable. That's just a short disclaimer. But I will say, tell your IBD team, tell everyone that's going, because they might actually be able to help you more so than you thought, and to give advice around going to a travel clinic depending on where you're going to. So it's really, really important to communicate that. And just to say that when you are traveling, certainly if you have IBD, it is well known that sometimes the destination is being picked because of your IBD. So you want to make sure you have access to toilets. You want to make sure you have access to clean toilets. You want to make sure that you have access to suitable food that you know you'll be able to tolerate. You want to make sure that if you do experience a flare and it's significant, that you've got somewhere to go close, and so depending on where you are in your journey with IBD, you might feel more comfortable, more competent to be more adventurous. And I don't know, maybe go into a jungle. Can't say I'm brave enough to do that. Anyone who does that, you're bold. I adore you. I do like to get outside when I travel. I'm not the person that just likes to lie on a beach, okay, and just indulge in getting vitamin D. But I will say there's some things I can't say that I would be excited to do, like jump out of a plane or, I don't know, sleep with boa constrictors. Having said that, know where you're going to go, communicate with your IBD, and make sure that the things that you need to make your experience positive, like accessibility and medications, is available. And there are ways to do that. One interesting thing that I did learn about adults as well, which I find fascinating, is that there are predictors as to whether or not somebody with IBD might experience a flare while they're traveling. And interestingly enough, this recent study showed if you have an elevated fecal calprotectin, if you have had recent it was about 3 or more visits to the emergency room for flare-related issues, and you have comorbidity. So that is another condition, another health condition, another health disease that has coexists with your IBD, you actually might experience a flare related to air travel. So why do I bring this up? I'm only bringing this up not to have anybody worry if their FCAL level went from 500 to 602, okay, before you go to Switzerland. I'm bringing this up because what it does is it highlights that all of these variables suggest that maybe you're not in clinical remission. So before you travel, you want to check in with a medical team, make sure that you are in remission before you travel. So it means take the time to really put in the prep, as opposed to, which is, I know, not fun, being spontaneous with IBD when you're traveling. Okay, so just know that there are variables that can ensure that your trip is a positive experience when you communicate with your IBD team, and to say that you want to be open about talking to your IBD team because they can certainly help with identifying risks when you do have IBD and you're traveling. So traveler's diarrhea is a known thing, as is traveler's constipation for everybody. I do not have celiac disease. I do not have IBD. I tell all the patients I work with, but I certainly have experienced both. TMI, yes. Why? Because it's common. So if you are impacted with a GI condition, this can actually exacerbate your underlying issue. It might impact your symptomology while you're away. So chat about it and know what you can do to either prevent it or treat it while you're away. If you are going to certain parts of the world where, for example, there's tuberculosis, you definitely want to talk to your IBD team. There might be roles for vaccinations or certain medications before you travel. And going to a travel clinic, which I've been to, is extraordinarily helpful. So just know they exist and you can get referrals to go. You also want to be very open with your team around ensuring that you get medical insurance when you travel and that you know that you can find medical care relatively, not easily, but that there's accessibility for when you go. And chat about those options with your team, which I will say the Crohn's and Colitis Canada website does have very, very good information for details related to that, that you can see. So if we're talking about planning, I think that was the combination word that I made up earlier at the start of this webinar. You definitely want to talk to your IBD team. You want to make sure that you've got letters if you need them for travel, particularly if you have certain equipment needs. So I can certainly tell you, I know patients who've been on exclusive enteral nutrition therapy and they've traveled. They've needed to travel with enteral pumps, nasogastric tubes, syringes, formulas. I mean, we're talking about, weight and extra luggage, which we've been able to get covered because there was medical letters. Families contacted airlines ahead of time. So whatever else that you need, weight-wise, luggage-wise, travel-wise, make sure that you have that sorted before you go. Before you travel, source local pharmacies, local clinics, local hospitals, just in case you need them. Make sure you're insured. Make sure you have all your treatments that you take with you packed. Put them in the carry-on. Please put them in the carry-on because goodness knows where your luggage nowadays ends up. I've had my luggage all over the world. My luggage has a better passport than I do. That's all I'm going to say. There's way more stamps on my luggage. So you always want to have it in your carry-on. Take it with you. And also be very mindful if you're on certain controlled drugs, if you're on certain pain meds, depending on where you're traveling to, you may or may not need a letter to travel with. Definitely pack all your needs. I include in that food, snacks. So important. Whatever snacks it is that you tolerate, non-perishable items, take those with you because you don't know where you may need to be waiting, and you don't know if you'll be able to access what you know sustains you, gives you energy, but also you're able to tolerate. And again, there are a lot of online communities that can be very helpful. They can do translations for you. They can also tell you about sourcing local food. And again, hoping it's something that you can tolerate. We do know that when you travel, not only are there risks of getting infections, but your microbiome changes with the environment that you're going to, as well as the food that you're eating. So I often tell families you really want to avoid packaged processed foods as much as possible. You really don't know what's in them. You don't want to have too much filler, too much preservative, too much emulsifier. You really want to try to maintain your usual habitual intake and focus on whole, healthy foods. So the Crohn's and Colitis Traveling with IBD Guide is very resourceful. It's also extremely user-friendly. It takes you through all the different steps to help ensure that you're prepped and planned. And then I love this tagline, and this was actually a recommendation from one of the panelists this evening, someone through the entire community there at McMaster. And the Health Canada website for eating and drinking safely abroad says, boil it, cook it, peel it, or leave it, which I thought, what a great tagline. That might end up as a bumper sticker on someone's car. But these are general guidelines as it relates to eating and preventing infections that anybody can get when they travel, but might make somebody with celiac disease or IBD not feel quite so well. So hand hygiene, Hand hygiene is huge post-COVID. I think everyone knows it. The 3-year-olds I work with, I would say wash their hands better than any adult. Okay, they are on it, they love it, and they get stickers and hugs, right? If there's no soap or water, alcohol-based hand sanitizers work. Also water, depending on where you're traveling, there are certain parts of the world where the water, of course, may not be clean. Infections are usually related to contaminated feces that are in the food or water. So make sure that it is either disinfected or safely bottled water that you're consuming. The ice that you're consuming is not local water, but is made from bottled, safe, disinfected waters. Even for brushing your teeth, depending on where you're traveling in the world, you don't want to be exposing yourself to waters that potentially could be infectious. You want food that is served well cooked, and you want it hot. You don't want it at room temperature. You don't want it raw. You don't want it trendy. I know for foodies out there, this might ruin the chef's experience. However, you want to be safe and mindful that maybe your gut may not tolerate it. You only want to eat fruits and vegetables that are still in their natural state and they have been well washed. So you don't want to be eating salads where you don't know where the foods were washed or peeled. You want to eat foods that you peel yourself as much as possible, and or foods that are cooked. And you certainly don't want anything that's unpasteurized, which in very many places, particularly in developing countries, is a common practice. So I hope that tonight I've been able to share some traveling tips that can make a journey for someone with celiac disease or IBD positive. And just know with a lot of planning and preparing, you can minimize comorbidity and stress when you go away.